This short video is designed for patients who have come back from the dental practice with a Florida probe chart and would like to learn a little bit more about what they're seeing on their chart. It's very difficult to absorb all information while you're still in the dental chair. I'm sure your dentist or hygienist will have explained a lot of this to you, but because it's sometimes easier to recap at home when you have a video that you can pause, rewind and watch again. That's the purpose of this video, so I hope it helps. First thing to say is it's a very good sign if you have one of these in your hand, because it's a sign of a good practice that cares about your dental health and in particular your gum health. So the Florida probe, as you know, is a special probe that actually measures pocket depth. You probably heard that term. And what pocket depth means is, what this is showing you is this is where the probe is put. So when the dentist is checking your pocket depth, as they call it, imagine a pocket in your jeans, and this is your tooth here, this is your gum here, and between the two you have a pocket. And of course, being a pocket, debris can collect in your gum pocket just like it can in your jeans pocket. So that's where they're putting the probe, in a natural space that is already there. They're not making anything new, it's already there, and they're measuring it. These little marks here help them see how deep that pocket is. So this is showing you where they're putting it. So this is your gum, this is side on, so this is the tooth, this is the bit that you see above the gum line, this is the bit that's hidden below the gum line, the root, and they're basically measuring this pocket here. And it might be a very small pocket of 1 or 2 millimeters, it might be quite a deep pocket, it might go down here. And that is significant, and that's what they're looking to see, because from the top you can't tell. You have to go and measure, and unless you go looking you won't get a true picture of what you're seeing. So and what they do is they put the probe down to the bottom of the pocket, and then they lower this bit to your gum line, and then they press a foot pedal and that measures for them. And what it's doing is it's measuring from between there and the bottom of the tip, wherever that might be. The tip might be here, or it might be there if you've got a deep pocket. So that's what they're looking for. So just this little graphic shows there's a healthy tooth all tucked up in his nice healthy pink gum. Here a bit of plaque has got in, bacteria can now get in, it forms harder calculus, which of course the hygienist has to remove. So this is down in the pocket. Can you see this pocket here? So that's what they'd be measuring. Here, as you can see, very little to measure. Here, a much deeper pocket. Bacteria can get in, and as it gets in further and further, look what's happening to the gum. The gum is receding, and because the gum is receding, the bone underneath has to recede. If you imagine it didn't do that, you'd have your bone up here and your gum down here, and nowhere in your body do you have exposed bones. So that's, the bone has to shrink because the gum's shrunk down. And of course now your gum has shrunk, your bone has shrunk, and your bone is what's holding your tooth securely in its socket. So if your bone has receded, then this is when your tooth gets loose and eventually is in danger of falling out. So that is why your dentist and hygienist like to monitor you with the Florida probe and hopefully catch you, well, hopefully find you nice and healthy like this. But if you are developing gum disease, they can do something about it before it gets to this level. That's the point. So here's a picture of some nice healthy gum, or gingiva as you'll sometimes hear it called. Nice and pink and healthy with these little stipples on here like orange peel. That's all nice and healthy. So you see, this is what they call the crown of the tooth here. The root is hidden in the gums, and this is where the gum line should be. It should be right here, just where the crown meets the root. That's where your gum line should be. This one shows a bit of recession, so the gum line should be here, but it's not, it's down here. There can be many reasons for that, but ultimately this here is the recession. It can be quite sensitive, it's not always, but because the gum has receded, the bone has had to recede underneath it. So instead of the gum line being here and the bone maybe being here, now the gum is here and the bone is probably down here somewhere, and this tooth is in danger of getting loose and falling out. So that's the point. One more, this is showing you that's the gums. This is the bit that should be above the gum line, but you can see this bit here which should be hidden under the gums, but this here is recession. So that's slightly more yellowy looking bit here, because your enamel covers the bit that's above the gum line. The root is normally covered by your gums, so it doesn't need this tough shell of enamel. So here it's exposed and rather vulnerable. So that's what they're looking for. So let's go back to our chart here. So you have one of these in your hand, and it has what they call the legend here to explain what you're seeing. And in some ways it's fairly self-explanatory, but we do sometimes get feedback from patients that they find it all a bit overwhelming, they don't understand some of the terms. So in layman's terms, let's look at what we're seeing here. Up here, these are your upper teeth. Down here, these are your lower teeth. And with dental, rather confusingly, right is on the left and left is on the right. That's because if you can imagine somebody behind the screen grinning out at you, this is what the dentists see. They're looking at you, aren't they? And you're grinning out at them. So this is the right and this is the left. This is your front teeth, going back to your back teeth back here. When you see a gold colour one like this, that means it's a crown. Now your crown may be gold, it might be white, but this is the symbol in the Florida Probe software for a crown. So if it's gold, that means it's a crown. This one here that looks like a screw, that's an implant, because it is a titanium screw in your jaw, and that's an implant. See here, this one is missing. That's because the person's wisdom tooth is missing. So you've just got an empty space there. Down here, that's another space, it's a missing space. This one here is an impacted wisdom tooth. So instead of growing up like that, it's growing sideways and is impacted. May or not need removing, but it is impacted. So they make a note of that, because that could be a potential food trap, as they call it, which is what it sounds. You know, food can collect around there and that can make your gums inflamed. This here is a bridge. So when you're looking at your own chart, that's what you're seeing. Okay, these numbers here, this is actually the American numbering, but it's just telling the dentist which tooth it is. So in America, they'd say tooth number 8, and they mean that middle tooth there. Here in the UK, we have a slightly different numbering system, so your chart may look slightly different than this, but that's what that is. And then all these numbers and squiggles and these arrows and things like that, you'll see that if you have up arrows, what that means is an improvement in your pocket depth. So where it says depth here, it's measuring your pocket depth. So along this line here, we've got 2, 2, 2, 3, 1, 2, 2, 1, 3. That's the pocket depths. So when I was showing you before where the dentist measures the pocket depth, that's what they're measuring. That means that's 2 millimeters, 2 millimeters, 2 millimeters, 3 millimeters, 1 millimeter, 2 millimeters. And if you notice, if you remember before, this is your upper teeth, and this is the outside of your upper teeth. So in other words, if you grin in the mirror, this is what you're seeing. You grin at yourself. And this down here, do you see the slight indentation? That's showing you it's the back of the teeth. So this is the palate side of your upper teeth. If you were to put your tongue against your upper teeth, that's what you're seeing here. Go, sweep your tongue across the inside of your upper teeth, that is what you're seeing. If you put your tongue around the outside of your upper teeth, that's what you're seeing up here. And likewise down here, this is still the right, this is still the left, this is the outside of your lower teeth, and this is the inside of your lower teeth. And again, you see the little indentation, that's showing you it's the inside. Of course, you don't see the roots because those are hidden under your gums, but what you see is these little crowns of your teeth sticking out of your gums. So when the dentist or hygienist starts gathering this information, what they do is they measure each tooth at 6 points. So on this patient, on the right side, their wisdom tooth is missing. So if you put your tongue to the very back of your right teeth, on the uppers there, and just the very back molar that you've got there, you might have your wisdom teeth, but the very back one, what they do is they measure the gum at the back of that tooth, and then in the middle of that tooth, and in the front bit of that tooth on the lip side. And then when they come back around here, they measure that same tooth on the inside now, the one that's closest to the midline, closest to your front teeth, in the middle of the tooth, and the one that's furthest back. So on each tooth they're measuring at 6 points, 1, 2, 3, 4, 5, 6, and they're measuring that pocket. So back to the analogy of your jeans pocket, they're trying to see how deep your pocket is. So when it says depth, they've put the probe in, and then they've lowered the top of that probe to your gum line, and then they found that it's 2 millimeters deep at the back, 2 millimeters deep in the middle, 2 millimeters deep at the front. And then when they've eventually come round on the palate side, they found towards the front, towards your front teeth, it was 2 millimeters, then 2 millimeters in the middle, and 3 millimeters towards the back. Where it says GM here, that stands for gingival margin. That just means your gum line. Dentists and hygienists tend to say gingiva, it just means gums basically. So that's your gum level. So that's the gum level there where it should be, that line there. You see it's separating the crown of the tooth from the root of the tooth, that's where it should be. And these little black lines show you where the pocket is. So the hygienist has put the probe in to the bottom of the pocket, then they've lowered the top of the probe to the gingival margin here, the gum line, and it's recorded it for them. Now what they're looking for, because gum problems often have no symptoms and you can't see from the outside, so they have to do all these measurements, and they're looking, see here, see it's black, and that's telling you that the depth is, in this case, less than 4 millimeters and is likely to be healthy. It's likely to be not too much of note there. So your dentist or hygienist will be quite happy with anything that's black generally. Now I have to say at this stage that this is down to the clinical judgment of your dentist or hygienist to prescribe treatment specifically for you, because what your dentist tells you and your hygienist tells you will be based on your own medical history, your past, and you know what you actually have in your mouth. So it could be different for everybody, but generally speaking, black is good news. That means nice and healthy. Do you see here this back tooth? So this would be the last molar on the left hand side on the uppers, and you see now these are black, this one is black, but this one now is red. What that means is the pocket's a bit deeper here. It's between 4 and 7 millimeters, and on the back here the depth is more than 7 millimeters. Now if you remember what we were saying before about when the gum recedes, the bone has to recede underneath it, and then if the bone recedes then the tooth can get loose, because it's, imagine like a fence post that's not properly encased in concrete anymore. The concrete has receded, if you like, and you know, your fence post is loose, and it's a bit the same with the tooth. So that's why these deep pockets are of interest to dentists, and they may suggest that they do something in the practice and that you do other things at home to help with that. And to a great extent, a lot of these things can be reversed, and ongoing, if they monitor like this, and if your dentist and hygienist suggest treatments that they can do in the practice and you can do at home, you can really improve your gum health. So these little red diamond shapes here, that's a spot of bleeding, and again they do check 6 sites per tooth, so you know 1, 2, 3 this side and 1, 2, 3 that side, and they put a little red diamond shape wherever they see bleeding. They also go back and record any delayed bleeding, which is important as well, so they do look and they go back and record any. Ideally you want as little bleeding as possible in your mouth, but again everybody's different, so your hygienist or dentist can advise you more on that, but in an ideal world, no bleeding. If you have any, have we got any? Oh yes, we've got one yellow one there. See that yellow triangle? That is pus or suppuration, and here it's bleeding and suppuration, so there's a bit of bleeding and a bit of pus there. Now obviously you don't want pus around your teeth, just like you don't really want pus anywhere in your body, so again if you have any suppuration or pus, then your hygienist or dentist can advise you further on that. So these are your pockets here. See these blue bars here? The blue bars here are recession. So if you imagine you've got your tooth here, your gum line should be here, but instead of being here, your gum line is here, and the pocket underneath is here. So this would show as recession. So instead of having your gum line here, you'd see a bit of yellowy root here if you look in the mirror, and that's recession. And again, that is important, because you know, if the gum recedes, then the bone has to recede underneath it. So this is why all these things are important. These pink dots, those are plaque. So if you see any pink dots, your dentist records 4 sites per tooth this time, because basically they're asking, is there plaque on the tooth, and is there plaque in between the tooth? They're asking that on the outside of the tooth. So when they go to the inside, so on the tongue side in this case, there's only 1 dot there. So this tooth here is showing you that there is plaque on the tooth, and there is also plaque between the teeth. That's what that is. Yeah, up and down arrows. Up is good. Things are looking up. So, and again, that shows you here you've had improvement. And this is kind of the point over time. If you have your Florida probe charts done now and again, you're hoping to see up arrows. You're hoping to see things improving. Down arrows means deterioration. So most of these arrows are up, if you notice, but this one here is down. That means that this depth today is 3 millimeters. Maybe last time it was 2 millimeters, so it's got slightly deeper. And again, your dentist or hygienist will keep a close eye on anywhere where you've got a down arrow, because you see this one has now become 4 and is a red bar. Maybe that was 3 last time and it's getting deeper. So your hygienist or dentist wants to know about that, and they want to discuss that with you and hopefully reverse that. And if you wonder what that means, furcation means, if you imagine the roots of a tree, generally they're in the ground, aren't they? But if you've ever seen a tree where its roots are sticking out of the ground and there's like fresh air between them, you can actually see a space underneath. That's what furcation is. And furcation is measured as either 1, 2 or 3, 1 being the least and 3 being the most. So if there was a furcation of 3, that would be, you know, properly fresh air through the roots. So it would be sitting out of the gum, in other words, because the gum has receded and the bone has receded underneath it. So that's now getting vulnerable. So it could be, if you imagine that the gum line was here maybe, and you can see fresh air here between the roots of the teeth, that would be what the furcation means here. These little symbols here, like no entry signs, no attached gingiva, that's telling you that there's no attached gum anymore. So this tooth, there's a little bit of bone left maybe, but the gum is gone. There's no attached gingiva. There's no attached gum. So this tooth is not in a good way. These little symbols here, minimal attached gingiva. So that's showing you that there's still a little bit of gum left, but not that much. So that's what those symbols mean if you see those. So it looks like a lot of numbers here, but when you break it down, it's not too bad. You've got the depth and you've got the recession. So the pocket depth of, in this case, right, so here, the pocket depth was 1, but the recession was 3. So what you're seeing here is the recession is 3 here, and the pocket is another 1 millimeter beyond that. The change is showing you the direction of the arrow, up or down. Mobility. Mobility is obviously how mobile the tooth is, how loose it is. So the zeros are good because you don't want your teeth to be loose. But often what you'll find is they're using a couple of instrument handles and checking how loose the tooth is, and they give it a value of either 1, 2, 3 or 0. See, this one is 1. So that means this tooth is a little bit loose. This one is 1, 2, so that's a little bit loose. If it was a 3, it'd be really quite wobbly. So that's mainly what you'll see there. Here is just a sort of brief screening for them to give them an overall picture of whether you've got 1s and 2s, which is good, or 3s and 4s, which are getting a bit deeper. Diagnosis is showing whether you've got periodontitis, which means gum disease basically, so slight, moderate or severe. You've got a plaque here, so the pink dots here have been put graphically down here so that you can see where your plaque is, where you need to try and reach with your toothbrush. And down here, this is a summary of the last few visits, so your dentist or hygienist can look at this and see instantly whether you're getting better or whether things are deteriorating. So I hope this short video has helped you understand the value of the Florida probe, why your dentist or your hygienist has used the Florida probe on you, why they will suggest using it from time to time. It's very much an ongoing health screening in a way. It's an ongoing monitoring tool to make sure that your gum health is as good as it can be, and if there are any problems that they're picked up early before you lose any teeth, hopefully. So that's the point. I hope you found this interesting. Be assured that using the Florida probe is a very good sign of a good practice, and they're looking after you well.